Acupuncture has been a common treatment technique in traditional Chinese medicine for hundreds of years. More recently, it has become an established technique within Western medicine culture, and its use is becoming very popular for treating pain as well as many other health-related problems. Physicians in the United States began using needles to specifically place them in areas of pain, especially to relieve myofascial trigger point pain. Trigger points are tender spots created by hardened muscle tissue producing localized pain. Dry needling is now an accepted practice in the United States by physical and occupational therapists. Listed here are the major questions you should be able to answer after viewing this presentation. These questions will again be displayed at the end of the unit for your review. Pause the presentation in order to take time to carefully read and understand these questions. The major points in acupuncture treatment are located on 14 major meridians of the body and primarily named after vital organs. In addition to placing acupuncture needles in specific problem areas of the body, needles are placed along the meridians on some of the nearly 400 specific points which are identified to be useful for treatment of specific organ problems as well as to treat general well-being. A licensed acupuncturist must be familiar with all of these points and their proper use. As a licensed acupuncturist, I have treated a variety of medical problems over many years and have always included the 4 gates in Chinese medicine to promote overall health and well-being. These 4 points include the bilateral 4th point on the large intestine channel, or LI4, located between the 1st and 2nd metacarpal bones in the adductor pollicis muscle. This point is named the Heigu point in Mandarin or Chinese. The other 2 points are bilaterally the 3rd point on the liver channel, or LV3, located between the 1st and 2nd metatarsal bones in the distal portion of the adductor hallucis muscle. Pause the video to allow time to read the information on this slide. Over the past several years, much research has been completed providing proof of efficacy in the use of dry needling to relieve pain. In this article, dry needling of myofascial trigger points, or MTRPs, located in the upper trapezius muscle, resulted in statistically significant improvement by decreasing the Oswestry Disability Index score with a p-value of 0.003. Pause the video as desired to review the abstract of this research article. After years of practice, I recommend acupuncture needles to be used in dry needling to be 40 millimeters in length and 0.22 millimeters in diameter. Transcutaneous electrical nerve stimulation, or TENS, is commonly used in therapy to relieve pain in joints and muscles. The stimulation is offered at a sensory level intensity by using surface electrodes placed near the painful area on the skin. In acupuncture and dry needling, the stimulation can be applied by connecting the electrical stimulation device directly to the needles by using alligator clips. This bypasses the need to force the stimulation through the skin and underlying fascia as the needles are placed directly into the muscle. This is referred to in physical modality texts as acupuncture-like stimulation to relieve pain. The device should be set to a stimulus frequency of 2 times per second with a sensory-only amplitude and offered for a total of 15 to 30 minutes. Take time to read the recommendations at the bottom of this slide. This slide shows the recommended sites to be used for dry needling when treating shoulder pain and should be done bilaterally, even if pain is only in one shoulder. Pause the video to allow time to carefully review these recommended points. This slide shows the recommended sites to be used for dry needling when treating occipital headaches and/or posterior neck pain. Pause the video to allow time to carefully review these recommended points. This slide shows the recommended sites to be used for dry needling when treating low back pain or sciatic pain. The needle placed in the popliteal fossa of each leg is chosen as it is slightly below the point where the sciatic nerve divides to form the tibial nerve medially and the fibular nerve laterally. The bilateral points used between the calcaneal or Achilles tendon and the medial malleolus is the pathway of the tibial nerve entering the foot. The bilateral points used between the calcaneal or Achilles tendon and the lateral malleolus is the pathway of the fibular nerve entering the foot. Pause the video to allow time to carefully review these recommended points. This slide shows the recommended sites to be used for dry needling when treating medial or lateral epicondylitis and should be done bilaterally even if pain is only in one elbow. Pause the video to allow time to carefully review these recommended points. This slide shows the recommended sites to be used for dry needling when treating knee pain and should be done bilaterally even if pain is only in one knee. Pause the video to allow time to carefully review these recommended points. This slide shows the recommended sites to be used for dry needling when treating pain caused by arthritis of the wrist or hand and should be done bilaterally even if pain is only in one wrist or hand. Pause the video to allow time to carefully review these recommended points. As at the beginning of the presentation, listed here are the major questions you should be able to answer after viewing this presentation. Pause the presentation in order to take time to carefully read and understand these questions.